Thank you, Lei, and it's a pleasure to be here. And I would like to thank Lei because he did all of the work. So David and I are co-conspirators, but Lei did most of the work in putting the program together. I'll give you some snapshots of research that we are doing in my group, AI applied to healthcare applications. And let me start clearly by something that we have all experienced for the last 2.5 years. We are emerging out of the pandemic. During the pandemic, we put together a team and we worked with a number of other groups across the world. We looked at a variety of data sets, and you can see here a list of places. So we work with both regional data sets, but also national data sets, a data set from Mexico, another data set from Brazil. And we developed models that predicted the level of care requirement for patients that were infected with COVID. So predicting whether they would be hospitalized, whether they would need attention at an ICU, ventilation, even mortality. In some of the most recent work we have done using a data set from the Boston Medical Center, this is the BU affiliated hospital system, we found that there is a very significant role that social determinants of health play. And we also saw that models that are developed in perhaps a more naive standard way, they exhibit biases, a variety of biases, and one has to be careful and try and correct these biases so that you get models that are more colorblind. Because we are thinking about potentially the next pandemic, and NSF apparently is also thinking along the same lines, we put together a large multidisciplinary team. This is a team that involves 5 centers here at Boston University. It may be the only grant that involves 5 centers at BU, and I think it highlights the important role that interdisciplinary centers play. And this team is thinking about ways to predict and hopefully prevent the next pandemic. So Alzheimer's and dementia is a very debilitating disease. Some of us have experiences in our immediate families. If you look at the number of people that are suffering in the US, a very large number, more than 5 million. If you look at the costs are staggering. And most of the clinical trials for Alzheimer's fail, the vast majority. And the conjecture is that the reason they fail is because they target individuals at a later stage of the disease when already they exhibit severe symptoms and maybe there's not much that can be done at that point. So one of the interesting questions is whether we can identify individuals much earlier in the course of the disease, and also whether we can democratize screening. So if you think about screening for Alzheimer's and dementia, it is available, but it is available in very limited, very well-resourced settings. How do we make that global? So we developed an AI-based pipeline that essentially uses voice recordings. And based on those voice recordings, the interesting aspect is that we use modern ASR tools, automated speech recognition, and then natural language processing to process the structure of the sentences, and based on that, to classify the cognitive status of the individuals that were screened in that way. This pipeline does almost as well as clinicians, and we have set up a new study where you can anonymously contribute data, you can do a screening, and that's a way of getting additional data. Thinking about models that are applied in healthcare, 2 are really important desiderata for this type of models: interpretability and robustness. We have developed a new framework, which we call distributionally robust learning, which is very applicable. And these are 2 applications of that specific framework. We have developed models that predict pregnancy outcomes. So this is joint work with the School of Public Health. And also in another application, models that are prescriptive rather than predicting make recommendations for personalized type of treatment that would be applicable to individuals with hypertension. I will just stop here, and if there is any burning questions, I'm happy to answer, and otherwise we can go to the next presentation. Thank you.